Thanks very much. So I'll be quite brief. I'm going to just briefly summarise work package 12 within the Torch programme. And this is a piece of work that's ongoing. We don't have any data yet, so I won't have any results to present, but I'll just briefly outline what we're planning to do within work package 12. So the idea here is to develop a set of mapping algorithms or exchange rates between child and adult descriptors of child health states and values of those child health outcomes. So for example, if you have a set of parent descriptors of childhood health states, you want to generate childhood values for those health states, we hope we will be able to the mapping algorithms that we'll be developing would allow you to do that, and vice versa. If you have childhood descriptors of childhood health states, the algorithms would allow you to generate parent values for those health outcomes. And the idea is that if you have these different mapping algorithms or exchange rates, it will enhance the possibilities of generating utility values for different descriptors of childhood health states that might be available within clinical trials or observational research studies, cohort studies, and so on and so forth. So just to remind you, this is the slide that Elizabeth presented earlier, or a slight variation of it. So within Torch, we're going to generate a number, I think it's 16 different value sets for testable health states. And those value sets will differ depending on the valuation protocol that they've derived using the best worst scaling method or a discrete choice experiment, a DC approach. The respondent type, whether the values come from children themselves or parents or general population samples, and also the target age range. So whether the health states that are being valued are health states for toddlers or for young children or aged 12-year-olds or for teenagers. So this sort of permutation of the valuation protocol, respondent type, and the target childhood age range will generate 60 different value sets. Now, what we have here is independent samples. So what we don't have within Torch is any plan to generate values from children and parents of those children. So our childhood sample is independent of the parent sample. So there's no sort of direct relationship between the children that are included in our childhood samples and the parents that are included within the parent samples. And so we can only analyse the data here at an aggregate level. We can't analyse the data here at an individual participant level. So we can't develop exchange rates or mathematical algorithms between the descriptors and the values for these childhood health states, depending on the respondent time and the target age range. So here we're only working with aggregate data. So as part of work package 12, we've developed this analytical strategy to develop these exchange rates or mapping algorithms based on the data that we've been collecting within work package 7. And there are a number of different plans here. So we're planning to assess the differences in these Petrou value sets between responding groups and valuation protocols through a number of different approaches, basically 5 strands of research. The first strand involves an assessment of the relative importance of Petrou items, encompassing the maximum value decrement for each item. And we can also do a further subgroup analysis, which will determine the relative importance of each Petrou subscale and their ranking compared to each other. The second strand of research involves an assessment of the differences between value sets in terms of the utility scale. And so that's going to give us an indication of the willingness of respondents of different types to trade off quantity for quality of life. We're also going to be looking at differences in the location of the descriptive midpoint in the utility distribution. We're also going to be estimating marginal effects moving from one severity level to another severity level for all of the 23 Petrou items. And for each of these value sets, we're going to be locating on the utility scale the descriptive Petrou midpoint. So mainly the health statements indicating some problems for each of the 23 Petrou items. And then there's the final plan, which is to use a particular statistical test called the Swint-Nuffield test to determine whether the differences in the derived utility scales between these different respondent groups and different valuation protocols are statistically significant. So that's the approach we're planning to use to assess the differences between these value sets that are going to be generated from different respondent groups using different valuation protocols. Now, what he already also said in the original proposal was that we would seek data with individual participant level information that contained information both from parents and children on their descriptors of pets, descriptions of the child's health life using the Petrou generic core scales. We've identified one trial data set which would allow us to do what we originally planned, which was to assess, to generate these mapping algorithms between essentially the parents' descriptions of the childhood health and the parent and childhood utility values, and vice versa between the child's descriptors of the child's health and the parents' utility values, the parents' value for their health. So we're going through the process now, getting access to that data set. We've had to set up a data sharing agreement with the university that's providing the data. At the moment, we don't have the data. And similarly, with the web package 7 validation studies, those studies are ongoing, so we still don't have those data sets. So we haven't done any of this analysis. The plan is to be doing this analysis between October and March of next year. So that gives you a very brief overview of what we're planning to do for web package 12. Sorry, I don't have much to show you, but this is an overview of what we're planning to do. But we welcome any suggestions or any other approaches that we might use to look at these relationships between parent and childhood descriptions and different values that might be relevant to those descriptors. So, okay, any suggestions would be welcome. The idea also is to sort of hopefully come up with a set of methodological recommendations or guidelines on how you might use data. If you've got data from one respondent group applying one particular evaluation protocol, how you might apply these different exchange rates or mapping algorithms to generate different types of values that based on this raw data. So it's generally.
Sorry, I'm probably being dim. Something you said sort of implied that you would use the adult values if you've got a proxy response and the child values if you've got a child response. Is that what you're suggesting? Because I can't really see any rationale for that. Or have I just misunderstood what you said?
So the idea is if you've got data from a trial or research study, when it might be an observational research study, you might have to just the parents' descriptions of the child's health reports, right, using the protocol. If we can generate these mapping algorithms, we'll be able to you'd be able to estimate the childhood utility, the child's perspective utility value for that parent descriptor.
Okay. So in how they respond to the protocol, so it's not really about the valuations, it's just about how they respond to the protocol.
Yeah, in order to generate these mapping algorithms, foreign exchange rates, we do need data from external data sets, which
Yeah.
would allow us to generate these, to construct these.
Thank you.
So for the middle one, marginal effect of moving from one severity level to another, just curious, where is that one going? So if you find like not much meaningful difference between no problem and some problem, what's the next step?
Yeah. Well, we haven't done the analysis yet because we haven't got the data. So, yeah. If there's no, well, I think there's no significant difference in terms of moving between one severity level to another. I think that's an important finding. I don't think it necessarily implies that the results will be correct.
So you're not looking to reduce the items?
No, this is based on the existence of this, based on the existing 23 item structure and the levels within each of the items. So be able to estimate the utility decrement moving between one level or another for each of those 23 items.
And just on that, I haven't spoken to Elizabeth about it, but my expectation is not all the levels will, what's the fancy term you use, monotonic?
Oh, yeah,
They're not going to be monotonic, which means you're not necessarily going to be able to do it for all 23 items.
Yeah.
Yeah.
Yeah, I mean, I think, yeah, I mean, we have to wait and see what the outputs show us. So,
Yep.
do people think this is a useful thing to do? I suppose that's a key question I would like to sort of throw out to you. Having these sort of tracking algorithms, when we develop the proposal reporting, because there are a lot of personal data sets out there, and a lot of personal data are based on sort of parents' descriptions of child's activated life. And by developing these mapping algorithms, we'll be able to generate values for those personal health states from essentially different perspectives.
I think that's something I can answer. Should be someone from the end users.
Just off the top of my head, I'm guessing the question is, would there be a preference for a proxy parent versus a child self-report? Is one going to be deemed the more acceptable, more preferred, in which case then a mapping kind of makes sense. You map from the least preferred to the more preferred. So if later on there's a preference determined by an end user, then you've got all your bases covered. I guess that's probably one aspect. I think the other one is if you've got such a multiplicity of valuation systems, trying to figure out which one you want to rely on. You know, you either do it from first principles and say, no, I really want what the child thinks, I don't care what the parent thinks. That's one way of normatively coming up with an answer to that. But maybe the analysis will show that there are superior performance characteristics from the five dot points you've got there. It says, you know, really, if you want to do something that's really responsive, this variant of the PED-SQL valuation system, this 16th one, is the one you really want to use. And so I guess there might be another way of determining a preference for any one of them. I mean, I remember when EQ5D only had 3 levels, it was a useless responsive instrument. Why would you ever use it for a medicine that might improve health? Because it's just either not going to show any change, or when it does, it's this huge difference in the value set. And you think, well, that's not meaningful, that's not really what's going on in that patient. So I can see how you could use both those elements of this analysis from an end user perspective. But that's off the top of my head. Other people can think about other aspects.
I suppose my worry would be if the aim is to map from from parent views to child views, then you have to do that in a sample where you've got both. But where you're most likely to want to use that is in a sample where parents have to complete for one reason or another, either the child is too young or the child is not able to, and then you're extrapolating into an area where you don't have data, so you don't really know if it's a good extrapolation or not. I suppose that would be the worry and the sort of caveat that you'd have to have.
Yeah, absolutely.
From a very narrow perspective, the end user, if the end user means the clinician, I would say yes, because I work alongside clinical trials and clinical registries, and I think there's one instrument that's accepted by most clinicians without the need of me arguing why we want to include a quality of life instrument, and that one would be PASCAL. So it's really well accepted in the clinical community, and then they usually include this measure even without me asking. And then there are many existing data sets with PASCAL, but I guess that's a different question to whether it's measuring what we want. Yeah.
Sounds like we should do it.
Yeah.